When you go to the emergency room, asking how you will be billed is probably not top of mind.
No, but the answer can determine how much you have to pay to get that care you need.
Consumer investigator Kristen Byrne took on one man's case after a call for action complaint and gets results.
If you've never heard of the term observation status, you are about to become very familiar with it. It's a medical term meaning outpatient. And a Milwaukee man says once he learned about this label and how it hurt his coverage, he realized a very vulnerable population might also be in the dark. On December 1st, Michael Lopez found himself in an emergency room in Cudahy.
And so what were your symptoms?
I had extreme back pain.
It was just excruciating pain.
Correct. It took my breath away. I was visited by a surgeon and she's like, hey, test results came back. Gallbladder's got to go. Less than an hour later, I was in surgery.
Surgery followed by 2.5 days in the hospital. So imagine his surprise when he saw the hospital billed it as observation status, which Medicare considers outpatient service.
2 overnights in the hospital. So how does that not make me an inpatient? I'm a little confused by that.
Here's how this classification hurt Lopez. The hospital visit was about $35,000. After insurance, he owes about $4,500. But Lopez also pays for extra coverage called supplemental health insurance in case he ever has a big bill like this one. He qualified for $1,100, but because of those 2 words, observation status, he can't use it.
I submitted my claim to them and it was denied.
Do you know why, to this day, why you were classified as observation status?
No, I don't. Other than they state they follow Medicare guidelines.
And right on Medicare's website, it says the decision to classify a status as observation or inpatient is made by your doctor. Michael's doctor works for Aurora. We reached out to ask why his 2.5-day hospital stay was considered outpatient. In a statement, a spokesperson said patients, quote, could be in observation or outpatient status for a 2-day stay or longer based on their medical needs and condition. Physicians cannot change their patient's status after discharge. When we reached out to Michael's insurance company, Aetna, we were told his stay, quote, has since been clarified with the facility and that his claim is being reprocessed and he will be receiving payment within a few days. Michael did receive that payment and has this advice for others going through a similar situation.
I would strongly advise other people to advocate for themselves as well, especially Medicare beneficiaries.
The I team learned the classification process of using observation status is on the rise. According to the Medicare Payment Advisory Commission, between 2012 and 2017, outpatient visits jumped 32%.
Okay, we've learned a new word here. This, though, does seem to be an issue that is affecting a lot of people.
It does. It has huge financial impacts. In fact, if you are a Medicare beneficiary, especially, this is going to impact you not just during your hospital stay, but even post-hospital stay as well.
So what do you do?
All right, so if you are a Medicare enrollee, all hospitals, they are required to tell you if you're under observation status within 36 hours.
Okay.
But if you're not a Medicare beneficiary, know that it is your right to ask your doctor, hey, how is my hospital stay being classified? Am I being classified as inpatient? Am I observation status? And then if you don't agree with it, there are patient advocates that are out there for help.
And we have something up at tmj4.com.
We do, our website, and then also too, talk to me, reach out to me, Kristen.Byrne at tmj4.com. I'd love to hear from you.
All right, Kristen, thanks.
Thank you.